Now, I would like to introduce the York International team. To begin with, I would like to introduce Eugene Lee, who is the International Student Experience Coordinator at York International. As I mentioned before, I'm Zhang, and I'm a student coordinator, and with me are my colleagues Amika and Pierre. By the end of this webinar, students will have more knowledge on the scope of UHIP coverage and how to access health support as an international student, key dates associated with UHIP, for example, deadlines, enrolling dependents, payments, communication methods, etc. You will learn more about the difference between the UHIP coverage and extended health plan coverage, which is very important, and other wellness supports available at York University for international students and how to access them. Before we start, I would quickly go through the agenda for today. So first, we will go over the University Health Insurance Plan, which is also known as UHIP. And then I will give a presentation on extended healthcare plan for undergraduate students on behalf of York Federation of Students, which will be followed by a presentation given by York University Graduate Students Association on extended healthcare plan for graduate students. After, we'll have our Q&A section, and as a reminder, you're welcome to ask your questions using the Q&A feature throughout the presentation and during the Q&A time at the end of presentation. Lastly, before we wrap up today's webinar, I will be sharing some of the upcoming York International pre-arrival webinars and fun events. Now we'll get into all you need to know about your University Healthcare Plan, otherwise referred to as UHIP. Now it's my pleasure to introduce Natalie. Natalie, please take it from here.
Good morning, everyone. How are you doing today? I hope that you're enjoying your time, whether it's the morning where you are located, afternoon, or evening. So I'm here to talk to you about the University Health Insurance Plan. This insurance plan is your basic medical health insurance. So the topics that we will go over today about this plan is where you should go to stay healthy using your UHIP card, the components of your healthcare coverage. We'll also talk about health and wellness resources, and then afterwards, there will be time for questions and answers. So if you speak French, you will find that the slides in this presentation will be bilingual. I will be presenting in English today, but if you do have questions in French to ask, please do not hesitate and I will respond in your language of preference. So when you come to Canada, you will find that there's a lot of places where you can go to stay healthy. The first points of contact for you as students will be to go to a pharmacy, a doctor's office, or a hospital. So other medical providers have to be accessed in a secondary manner. So you need to be referred to them before you go to them. So just keep in mind, if I'm not feeling well, I should go to a pharmacy, a doctor's office, or a hospital. On the side, you will find the kinds of ailments that you can have to go to certain entities. So, for instance, if you have a non-life-threatening situation, so say, for instance, a rash on your skin or you have a pimple on your face, the first point of contact would be a pharmacy. Chances are that if you go see a pharmacist there, they'll be able to give you something, either recommend something over the counter, or if the ailment that you are going through is part of the 19 ailments that a pharmacist can diagnose and prescribe medication for, then they will give you a prescription for a medication. Why is this important? Because it is fairly costly to go see a doctor. That being said, you do have insurance, but depending on where you go, say for instance, if you go to the clinic on campus, you may find that you're charged an administrative fee, and that administrative fee is not reimbursed. So I'm telling you to go to the pharmacy when you can, because that way you save some money and time waiting for a medical appointment. So if you are feeling unwell and it's not something too serious, check out a pharmacy first, and chances are that you're going to be able to be supported there to get you back on track to being healthy as quickly as possible. When should you go to a doctor's office? You should go to a doctor's office when you have non-life-threatening situations. So, for instance, if you have a cold, a flu, a fever, and it's something that you have experienced before, so you know more or less that you're going to be okay in the long run, but it's just a matter of getting the right medication to feel better. The other situation would be if you have a common or a complex ailment. So, for instance, um, in my case, I suffer from acne. So therefore, I've gone to the pharmacy. Their medications don't work. So what do? I go to the doctor's office when I have a flare up and I see what they can give me for that. Other chronic ailments that you may have managed by a doctor would be things like diabetes, for instance. So whether it's type 1, type 2, you would go there in order to have your ailments managed on a regular basis. So, when I say non-life-threatening situations, I am talking also about ailments that you may not have experienced before, but they are not very severe in nature. So, for instance, if you have a stomach ache, but it's not really worsening and you still don't know what it is, you start off by going to a doctor's office, and then they can start determining whether or not it's something they can diagnose right there on the spot or if they need to refer you to a medical specialist. For In order to see a medical specialist, you always have to be referred to them by a primary care provider, so either uh, a doctor or a nurse practitioner here in Canada. You can't go see a medical specialist independently. If you do, and they are able to see you, this is not going to be a cost that's reimbursable by your health insurance. The reason being that they would be unable to determine if your visit was medically necessary. So therefore, when you do have a medical ailment and you're not really sure what it is, just go to a doctor's office if it's a non-life threatening situation. Now, if you are experiencing something really, really severe and it's quickly worsening, say for instance, again, a stomach ache, but it happens to be on the right bottom side of your body and it's worsening by the minute, go to the hospital because chances are that they will need to assess whether or not you have something more severe like appendicitis or something that needs urgent um, medical intervention. So, when should you not go to a hospital? When you have, say, an ailment like COVID and you're experiencing symptoms that you've experienced before. If you've had the illness before, don't go to a hospital for that. But if, for instance, you're experiencing any sort of respiratory illness and you can't breathe anymore and you're wheezing and you're turning blue, then yes, under those circumstances, call 911, which is the emergency line here in Canada, and an ambulance will come and take you to the hospital. Now, if you can get yourself to the hospital safely, then do so. And just go visit the emergency department. You can use your UHIP card for that purpose as well. The other situation where you might end up at the hospital, and this might be either by self-referral or because you were referred to them by a doctor's office or a public health care office. That's in the event that you have a highly contagious ailment. So for this, I'm talking about a tropical illness or something like HIV, and it's just been diagnosed. You might be referred to a hospital in order for them to look after the acute stage of your ailment, and then they will prescribe the medications that you need for a family doctor to be able to do the appropriate follow-up thereafter. Or they might do the full treatment if it's something that can be cured, like an infection. So with that, don't worry if you don't remember everything. This is just the first go over of this to get you acquainted with our healthcare system. We will be discussing this at your orientation session when you come in January. So, as I've mentioned before, I've been talking about doctor's offices and hospitals. Your UHIP card covers you for expenditures there. The other locations where you're covered by your UHIP card is for laboratory services. So, if you need to get a blood test or a urine test or anything like that, or an MRI, for instance, those are services that are covered by your UHIP card. And as I mentioned before, if you need an ambulance, then you would also be covered by your UHIP card for that. The things that are not covered by UHIP are things that you will hear about later in this webinar, which are things like dental and vision care, getting your medications, so prescriptions, prescription medication, paramedical services, and vaccines. But I won't speak about that because you'll hear more about that later. Now, who is eligible for the University Health Insurance Plan? So there's a variety of people that are eligible for it. Here at York International, we work with international degree students, exchange students, international visiting research trainees, and some visiting scholars. Additionally, if you are in any of these categories and you have dependents, that being said, a dependent would be a spouse or a child, then they are also eligible for UHIP coverage. If you do not fall under these categories, then you would not be able to receive a UHIP card. So for instance, if you are pursuing a graduate certificate instead of a degree, then you would not be eligible for UHIP. Now, you're probably wondering, when is it that I'm enrolled? How can I make sure that I'm enrolled? I want to make sure I have my card ASAP. So know that the moment that you sign up for classes, this will trigger a list to be sent to me. And then I will enroll you because you have enrolled in classes. So the sooner you enroll in classes, the sooner you get enrolled into UHIP. The first day of enrollment for UHIP will be, like in terms of my activities to actually get you enrolled, will be December 1st, 2024. That being said, your coverage does not become active until the later of December 10th, 2024, or the day of your arrival in Canada. Why? Because UHIP is only valid when you are here in Canada. It's not travel insurance, so you should still get travel insurance when you're making your way here, but it is valid upon landing if you are here, provided that you have already enrolled in classes. If you have not enrolled in classes yet, don't be surprised if you do not see that you have coverage yet. So how can you know for sure that you have UHIP coverage? You will be able to tell because there's a charge on your student account. And as a result, that'll be the final proof that you have UHIP coverage. But I'll give you more information about that later. First, I have to tell you a couple of things. The cost of UHIP for international students is charged on a per year basis. So it's $756 if you started studies in September. That being said, if you're here, it means you're starting in January. So you will see that there will be a charge of $504 posted to your student account. What this comes down to is a cost of $63 per month per person. So if you have a dependent, you will see an additional cost added to your student account. Now, if you have dependents, it's important that you be very aware that there are deadlines to enroll your dependents. Dependents have to be enrolled within 30 days of arrival in Canada. If they are not enrolled within 30 days of arrival in Canada, you will be charged a late fee of $500. This is not a fee that York International is charging. It's a fee that the insurance company is charging. So it's not something we can waive. So as a result, the moment you land, please do not hesitate to email the UHIP office. The UHIP office email is uhip@yorku.ca, and you will see the email at the end of my presentation. But email UHIP to ensure that your dependents are adequately enrolled into UHIP as soon as possible. Do not delay with this. There's no flexibility with respect to the late fee. And if you want to know more about UHIP, please do not hesitate to scan the QR code. It's on your left-hand side. If you want to know more about applying for dependents, please do not hesitate to scan the QR code on the right-hand side. I will leave this screen up for a few seconds before proceeding to the next slide. Okay. And so, as I mentioned beforehand, how will you be able to see your UHIP card? So there's going to be an email that's sent to you by the insurance company. So the first thing that you need to ensure you do is you activate your York University email address. If you do not activate your York University email address, the insurance company will not send you the email. And then you might not know that you have UHIP coverage, even though you do. So as a result, if you have not yet done so, please do activate your York University email address. The insurance company would be emailing you after you are enrolled, so a couple of days afterwards. So if you see that you have enrolled in classes and a couple of weeks have gone by and you haven't heard anything, then check to see if you have activated your York University email address. And then if a couple of additional weeks go by and you still don't have your UHIP card, please email the UHIP office to see where your enrollment situation is at. That way we can support you better. And here you're going to find some very useful links. You're going to hear about your extended health insurance plans shortly, but if you are curious and want to start reading about your health insurance plans so that you can think about questions, here are some QR codes to be able to access that information. You also see some very useful information being shared with you in the chat right now. So I'll leave this up for you. But just so you know, at York International, we do not deal with the extended health insurance plans. So if you do have any questions about these plans, you need to contact your student union directly. So for that reason, you will see their email addresses on the screen there. Take note of them. They'll be very useful when the time comes to ask a question. And so as we're nearing the presentation, I do want to first recap what I've presented. So the cost of UHIP is approximately, it's $504 for the period of January 1st, 2025 to August 31st, 2025. That's equivalent to $63 per month per person. You will be charged that full amount when you first enroll in classes in the winter. Something you should know is that that full amount is payable upon posting on your student account. So it's not something that you can wait to pay. You will incur interest charges if you do not pay it within a month of it being posted. Additionally, I have talked to you about how to receive your UHIP card, which is by making sure that your York University email address is activated, and you will then receive an email message from the insurance company with instructions to view your card. If you do not receive the email and you have found that 4 weeks have elapsed from the moment that you have enrolled in classes and you have made sure that you are they have properly activated your York University email address and you still haven't received the message, then at that point in time, please email uhip@yorku.ca to ask about your situation, and I will follow up with you about your case. And finally, if you have dependents, that you need to enroll them within 30 days of arrival in Canada. Otherwise, you will be charged a $500 late fee that cannot be waived. And of course, finally, now you know also how to visit a doctor, which is to go to the pharmacy first if you don't have a very serious situation, then go to a doctor's office if you have a non-life-threatening situation, and to go to the hospital if you have a life-threatening situation. So with that, you have a general sense of how to keep your medical insurance in good order and to stay healthy and well. But some of the tips that we do like to share with all of you, and it's good that we're sharing them with you now before you arrive in Canada, it's that you need to also do some planning in order to be able to stay well. So before you arrive, try to think about this, about how your life might be like here in Canada when you arrive, especially since you're coming here in the winter. And just think about how you might schedule your wellness activities. So some of the things that you will need to do are to sleep well and eat well. You will also need to stay active. And so for that, you need to, not always be studying. Try to schedule some you time. You might think, no, my key task is to study. And yes, it is. But that's you planning for the future you. You can't get to your future until you also plan for your present. So on a daily basis, do make time to sleep well and eat well, and do take the time to stay active, whether it's by yourself or whether it's in a group setting, take advantage. Staying active does not necessarily mean you need to be, an Olympian or anything like that, but any small activity that can help you stay well is valuable to your body and therefore also to your mental health in the long run. Finally, you should also connect with people. So from the moment that you arrive, do think about getting involved in activities on campus, whether they're offered by York International or by other divisions. That way, you can become connected to others from the moment you arrive. This will be critically important, especially in your first term of studies, because the more that you feel that you belong within your society, the better your outcomes will be, not only in terms of studying, but also in terms of your well-being and your overall future outcomes in terms of being able to have a network and a support network also when you feel that you need someone because you're going through something. And finally, do take the time to also check in with yourself regularly regarding your physical health and your mental health. You might do this on a weekly basis or on a bi-weekly, monthly basis, but do check in with yourself just to make sure you're in a generally good state of health. So, but be honest with yourself when you do this. So ask yourself key questions like, okay, have I felt unwell at any point during this last period, like week, month, or something? Have there been things that I have not been able to accomplish? And what can I do to accomplish these things that I have in mind? And if you're not sure what the answer is, do seek support on campus. There are lots of resources that are available, and you'll be able to get more information about that. Um, when you come to campus, but do know that we do have counseling services available. We have York International. We do have Apple Tree Medical Clinic on campus as well. And of course, there's recreation activities and lots of student-oriented activities that you can engage in too. So do take the time to check in with yourself, because the sooner you notice that something's a little off, the faster you'll be able to look after it and the smaller amount of effort it will take. So finally, if you're not feeling well and you know it's a physical ailment, don't hesitate to see a doctor. The sooner you do, the better it'll be. And of course, if you're not feeling mentally well, do consider seeing a counselor. That is not something that is badly seen in Canada. On the contrary, it's well regarded that you look after your mental health. So do not worry that, if you tell someone, oh, I want to see a counselor, or I want to see a psychologist, that people are going to look at you weird. No, totally not. On the contrary, this is why you have insurance, because it's something that we all do here. So take advantage. And with that, I do see my time is coming up, so I do want to make sure that I give you some resources that you might be able to just scan with your cell phone so that you can start seeing what's available on campus. And you see the hyperlinks on the chat as well. And then finally, if you have any questions, do take note of the resources that we have for you to access information about UHIP. And also do not hesitate to ever email the UHIP email address. It's uhip@yorku.ca. And you can email in English and French. Now, the third link that you see on this webpage is the clients.cowangroup.ca website. That's going to be where you do all of your health insurance things for UHIP. So submitting claims, accessing your UHIP card, etc. So do not hesitate to even go to that website, even though you're not yet enrolled into UHIP, because then you'll have a sense of what it looks like. So it won't be strange when you see it for the first time and actually need to use it. So with that, I will turn it back to you, Zhang, and thank you so much, everybody, for listening to me.
Thank you so much, Natalie. I hope that you have some more insights into how UIF works and the services that it offers, and helpful tips to stay healthy and well, to take care of your present you, to prepare for the future you. I really need that reminder, Natalie, and I know that many students here do too. Okay, so before we move on, just a quick reminder, you can use the Q&A button to ask your questions throughout the presentation, and we'll be addressing them by the end of the webinar. Now we'll move on to the next presentation on the extended healthcare plan for the undergraduates. Just a disclaimer before we begin, the representative for the YFS, who was supposed to be here to share this information with you, unfortunately could not make it, so I will be sharing the information on their behalf. However, if you have any questions specific to the YFS extended healthcare plan, I will be providing their contact information at the end, just so your inquiry could still be addressed. Before we start, let me give you folks a brief introduction about YFS. So YFS is the Central Undergraduate Student Union here at York. So what this means is YFS is here to serve all the undergraduate students. They put together events such as York Fest, Culture Fest, or the upcoming Mental Health Awareness Week. They put up campaigns such as Fairness for International Students and Fighting for Free Education. They also offer cost-saving services, which include the YFS Health and Dental Plan, which I'm going to talk about today. So the YFS Health and Dental Plan is the extended coverage for undergraduate students. It is a comprehensive supplemental insurance plan, which all this means is they cover a little bit of everything from health, dental, and extended health services, all at a low cost. For students that enroll in 15 or more credits, they're all automatically charged with a fee and are eligible to opt out if they have comparable and alternative insurance, as long as it's done prior to the respective deadline. However, for part-time students who are enrolling less than 15 credits, they are not automatically charged for the fee, but students can still opt in using the opt-in application. And the insurer is the Green Shield Canada. There are 2 periods in which the students can opt in and opt out within the academic year. It depends on when you begin your studies for a year. For example, students that start their studies in the fall term, the opt-in and opt-out window is between September 1st and October 18th. And for students that start their studies in the winter term, the opt-in and opt-out window is between January 1st to February 7th. So to make it clear, you do not have 2 opportunities to opt in and opt out. You each have 1 opportunity to opt in and opt out, depending on when you start your studies, whether it is the fall and winter term. Students that opt in during the fall term, they have the full coverage for 12 months from September 1st, 2024 to August 31st, 2025. And for students that opt in during the winter term, they have an 8-month coverage starting January 1st, 2025 to August 31st, 2025. For students that have already been charged with the YFS Health and Dental Plan, you can choose to opt out. However, you must do it by completing the opt-out application by the deadline. The form is made available on the YFS website during that period, and students are only able to fill out the application once. And just as I mentioned on the previous slide, the opt-out deadline depends on when you start your studies. So the winter opt-out, it's only for students starting the course in the winter. It is a university policy for full-time students to be enrolled into extended coverage. So for undergraduate full-time students, the YFS Health and Dental Plan is mandatory. However, students can choose to opt out if they have alternative or comparable health insurance. They just have to fill out the opt-out application by the deadline. OHIP and UHIP are not considered alternative insurance because they have different coverage from the YFS Health and Dental Plan, which I will be talking about later. And when filling out the opt-out application, students need to be careful and meticulous because you only have one chance to fill it out, and your application can be denied by the Green Shield Canada if you fail to provide accurate and or eligible information. In some cases, the Green Shield Canada do follow up with you for additional steps if they require more information. As I mentioned before, students that are enrolling for 15 or more credits are automatically charged through their student account. There are situations when they're not automatically charged, and that's just because they could be part-time students that enroll in under 15 credits. There are students that are registered with accessibility services, or graduate students or students with co-op. However, they still have the ability to opt in using the opt-in application, which can be found on the YFS website. In these cases, you can opt in using the application, but they also require further proof or documentation. So for example, students that register with student accessibility services, they do require a letter of recommendation, sorry. For graduate students, they require proof of graduation, and for co-op, they might require transcript or contract. Active students have the option to add dependents, but it will be at an additional cost. This can be completed using the opt-in application and requires students to provide proof of relationship. And this can be done through things such as marriage certificates, birth certificate, and the application has to be done prior to the deadline. There are only 3 eligible dependents that can be added to the plan, and these are spouses, common law partner, and a child. This is the rate for the 2024 and 2025 school year. The rate depending on the status of the students. So depending on whether you're a part-time student or a full-time student, the rate differs. And if you want to add a dependent, the rate would change too. For example, if I am a full-time student, the rate would be $315.72. And if you would like to add an independent, it would be the additional cost of $316.32. All this are applicable as long as the opt-in application for the dependent is done prior to the deadline. The slides will be posted on the York pre-arrival website in case you want to refer back to the slides for rates, or you can go to the YFS website for this. So what it's covered. This is a very, very small list of what is covered on the YFS health and dental plan. If you want a full list, it's 30 or 40 pages long, and you can access that on the YFS website, which is the yfs.ca/health plan. But I will briefly cover what's mentioned here on this slide. Prescription is 80% up to $1,000. Acupuncture, physiotherapy, massage therapy is $50 per visit up to $600. Chiropractic care is subject to usual and customary charges per visit up to $650. Vision care is $70 per 24 months for the eye exam and $100 per 24 months for glasses and contact lens. And the dental care is $70 up to $600. Yeah. For some of this coverage, you have to look into it carefully. For example, for massage therapy, you need doctor's referrals, or for dental coverage, they only cover the basics. So things such as braces, those are not covered under basic care, the basic level of dental care. The plan is completely cardless. All you need is the information listed on this slide. It can be your student number or your insurance provider. And if you would like to see dental care, they do require the policy number. So your plan member ID is just YSF and your student number -00. The insurance company that they have is Grinshield Canada. The section division is YFS, and the policy number is 11111. All this information and the virtual card can be accessed at the YSF website at yfs.ca/healthplan. You're advised to download the GSC Everywhere app and create a login in order to receive a digital copy of your card. Okay, here we go. Creating a GSC account online. Students who are using the YFS Health and Dental Plan, they should create a Grinshield account through their website, gsceverywhere.ca, or by clicking on the link that's dropped in the chat. Once the account is activated, you can view your benefits, check the coverage availability, submit claims online, which is the most important thing, since if you go to a service that they do not allow to bill your bill directly to insurance company, you can submit the claim using the account. You can also sign up for direct deposit reimbursement, which will make your life so much easier. You can view your claim statements and more. Speaking from my own perspective as a student who are enrolled with YFS Health and Dental Plan, it's important to make a Grinshield account because it's really gonna make your life so much easier. Okay. YFS has 2 different emails for students. The first one is the general email. If you have any questions about the coverage or the opt-in or opt-out process, you can email healthplan@ysf.ca. The second one is the specific inquiry email, and it will be reviewed case-by-case basis, and the answer will be tailored to each unique situation. So if you have any questions that cannot be answered generally, you can email ysf@ysf.ca. Before we move on to YUCSA, if you have any questions about YSF Health Insurance Plan, their email is placed in the chat, and the location of their office is also included here for when you get to campus. Now we'll move forward with the extended healthcare plan for graduate students presented by YUCSA. Farhat, the stage is yours.
Hello, everyone. It's nice to be here and meeting you folks. My name is Farhat Hassan, and I'm the health plan administrator for the graduate student health plan. So I belong to the student union called YUGSA, which means York University Graduate Students Association. And you can see the website here, https://yugsa.ca. So if you go to our website, you will know what services we offer to the graduate students. This includes advocacy for the students. We give different types of fundings to international students as well as domestic students, and we provide the health plan. Eugene, can you give me the controls to move the slides? Okay, here it is. So before we begin the presentation, I would like to say that the YFS plan and the YUGSA plan has the same provider, which is Green Shield Canada. But the plan is operated differently because we are two different student unions. The premiums are also different. So for a full-time student, whether they are domestic or international, the premium is $410, which covers you for the academic year starting September to August, or if you are a winter student, it will cover you from January 1 until August 31st. The premium for part-time students is $815.84. Dependents can be added to the plan for an additional premium, just the way Yang mentioned in the YFS plan. The plan cycle for fall registered students is September 1 to August 31st. For winter registered students is January 1 to August 31st. There is no enrollment in the summer term. So if you are arriving in summer, some of you are arriving in summer, you will have to wait until fall, until September 1 to get enrolled in the graduate plan. Each year, there is a blackout period at the beginning of the term, which usually ends by the end of September. Your benefits will be, or in January, like since you are a winter registrant, in January, the blackout period will end by January 30th. So that the blackout period means that during this time, even though you have been charged for healthcare, your benefits will not be active. This is because of the administrative procedures that take place. The insurance waits to receive the file from York, and all that is done by January 30th. So until then, you will be registered, but you will not be able to make any claims to the insurance. So if you need to use the insurance, for example, if you feel sick and the doctor has prescribed some medications for you, you can still go to the pharmacy and purchase the medications, but you'll have to pay upfront at that time. So we suggest that you save all the receipts, and when your blackout period ends and the plan becomes active, you can submit everything to the insurance and they will reimburse you. What does the plan cover? So basically, the two plans are the same. The YFS and YEGSA plan are same. So the slide covers the summary of benefits. Is basically what Jan mentioned before. Prescription drugs is $1,000 maximum with 80% co-insurance. Dental is $600 with 75% co-insurance. Vision is $75 for eye exam and $100 for the purchase of prescription lenses or glasses every 24 months. Then there are professional services, chiropractor, psychologist services, nutritionist consultant, acupressure, and so many more. In addition to all this, you are also covered for travel. So the Green Shield provides you travel insurance for up to 60 days per trip. How to use the plan. So nearly all pharmacies and dental offices in Canada accept Green Shield insurance, and you can bill them directly, and they can bill directly for their services once you provide them with the information. So basically, there is no card. There's no physical card. All you need to tell them is the name of the provider, which is Green Shield, and the certificate ID number, which is YGS plus your student number -00. So if you have a dependent too, then the dependent information will be YGS, your student number -0102, like that. So the graduate student should note that though the insurances are same, the certificate IDs of graduate and undergraduate students are different. So YFS uses YFS, your student number -00, and the graduate students use YGS, your student number -00. So online registration, you need to create an account with Green Shield when you are charged for the healthcare, and through your account, you can do a number of things. You can submit your claims electronically. You can download the virtual benefit card. You can sign up for direct deposit. You can get your free benefit booklet. You can search for the provider. search for drugs, because many times students don't know if a particular benefit is covered by not, but there is a search function in your account which will show you. For example, if you want to know if a particular drug is covered, you have to either name the drug or there is a DIN in every drug. So if you enter that number there, the search will show you whether it is covered or not and by how much. Then you can also submit claims right from your mobile device by downloading the app, GSC Everywhere app. Making claims. So pharmacies and dental offices bill the insurance directly. You don't have to pay upfront there. So you just give them the information about the name of the provider and your GSC ID, and they will submit the claims. So one thing to note here is that no benefit is 100% covered by the insurance. For example, for drugs, it is 80% covered. So the balance amount has to be paid by you. Other than pharmacy and dental office, every other claim you have to pay upfront, and then you submit the claim to Green Shield through your account. Opting in, who can opt in? So the plan is mandatory for full-time students, meaning they don't have to opt in. They will be automatically enrolled in the plan, and you will see the healthcare charge in your student account by January 20th. And if you don't see the charge by then, and you are registered full-time, I suggest you contact our office. My email is, I'll put it in the chat here. So just email me so that I can follow up with the Faculty of Graduate Studies and ask them like the reason why you were not automatically enrolled in the plan. And so full-time students don't have to opt in. The opt-in feature is only available for part-time graduate students. So there is basically a form given on our website to opt in. It will open on January 1 and it closes on February 28th. So you submit the form with your information, it goes to us, and you can even add your dependents. So when you add your dependents or you opt yourself in, at the end of the form, there is a fee, the premium that you have to pay. So that has to be paid online with your credit card. So this fee cannot be charged to your student account. It has to be paid by your credit card, because part-time students and dependents are in addition to the student enrollment. And this is something which is not mandatory, so it's optional. And if you want to join the plan, you pay the premium directly and the insurance will add you to the plan. Opting out. So who can opt out? Anyone who has a comparable health and dental coverage in Canada from another insurance can opt out of the plan. So when you opt out, the opt-out form goes directly to the insurance, and they assess the information that you've provided. If the information is satisfactory, they will let us know that it has been approved, and then we get the charge reversed from your student account. There is an opt-out form which is available on our website. It will be available from January 1, because currently it is fall term and the fall form is present. But it will be updated on January 1, and this website link will have that form. And the deadline to opt out is February 28th. Coordination of benefits. So if you have two different plans, if you have another plan and you want to, for example, if your spouse is covered under a different plan and you are enrolled in the YUCSA plan and you want to use both plans, it can be done. So if you can submit your claim first to Green Shield, which is your primary plan, and then whatever leftover amount is not covered by the insurance, you can submit to another insurance, and that way you get 100% covered for all your expenses. Lastly, this is the contact information for the YUCSA Health Plan. We are located in the First Student Center, room 325. And Tuesdays and Thursdays are our in-person hours. And for the rest of the week, we work virtually. The best way to contact me is by email. And once you send that email, you will get a response within 24 hours. So that's the most efficient way of contacting with me. This is all. And thanks so much for listening to this presentation.
Thank you, Natalie and Farhat, for the information on UHIP and Extended Healthcare Plan. We hope that you all have the opportunity to get an insight into UHIP and Extended Healthcare Plan provided by the YFS and the YUCSA and the services each plan covers, so you can have a better grasp of which plan to use depending on the situation. So now it's time for our Q&A section. As a reminder, this is the perfect opportunity for all of your questions and concerns to be addressed by a YUCSA and UHIP representative. As we're waiting for you folks to type in the questions, we have some common questions being asked at other events that we believe are beneficial to address. Okay, the first question I have is, what happened to my UHIP coverage after I graduate or leave the university? I believe, Natalie, you can take on this question.
So what happens to your UHIP coverage after you graduate? Well, that really depends on when you graduate. So if you finish your program in August, so in other words, if you graduate in August, then you will convocate in October. What that means is that your UHIP coverage will end at the end of the policy year, so August. So say, for instance, I'm going to make up a situation. You're starting in January 1st, 2025. You will finish your program in mid-August in 2026. Well, in that case, your UHIP coverage will end on August 31st, 2026. If you are staying in Canada to find work, or because you're about to enroll in another academic program and you're just kind of hanging out here for a little bit, in those situations, you can request a brief UHIP extension for up to a maximum of 6 months. That's the case for students that are graduating in August only. If you're graduating in December, so in other words, if you finish your program in December and will attend a convocation ceremony in February, or even June, depending on your program, then you will have already been enrolled in UHIP for the entire policy year, because enrollment happens on a yearly basis, as I mentioned in the presentation. So you will already have coverage until August of the following year. So let's say you start your program now, it's a 1-year program, you finish, I'm just making up a situation. You wouldn't be in a 1-year program. I'm making up a situation. So let's say you start January 1st and your program ends in mid-December 2025. Well, you will have been enrolled into UHIP for the policy year of 2025-2026. So therefore, you would have coverage from September 1st, 2025 to August 31st, 2026. And that's when your UHIP coverage would end, August 2026. You would not be allowed to extend further. Now, if you finish in April, so let's say you're starting on January 1st, 2025, your program ends April 30th, 2026, you would have been enrolled into UHIP for this policy year and also the next one, so September 1st to August 31st, 2026, and that's when your UHIP coverage would end at the end of that policy year. And then after that, you would be allowed to extend for just a couple of months maximum. All of this is contingent on your immigration status in Canada. So if you no longer have a status in Canada after you graduate, you will not be allowed to extend. So every case is therefore looked at on an individual basis. If you are facing this situation, then you will need to email the UHIP account. So the UHIP email address is uhip@yorku.ca, close to the time of your graduation, and we can discuss your situation further, and I can send you an application. Thank you.
Thank you so much, Natalie, for that useful information. We have a question in the Q&A chat, and I will be addressing it here. A student asked, "Hi, thanks very much for the great information." Thank you. Please, could you expand a bit on the blackout periods? If I start January 2025 for a 1-year program, what would be the blackout period? Thanks. I believe this question is addressed to Farhat.
Sure, I can answer that question. So the blackout period lasts generally 30 days at the beginning of the year. So if you are starting in January, the blackout period will continue until January 30th. So during this time, even though you can use the plan, you will not be able to submit any claims to the insurance. And as I said before, this is the time when the insurance is in the process of adding the students to the plan. They wait for York to send them the enrollment file. And until all that process is complete, they do not accept any claims. So it takes around 30 days for them to activate the benefits once they receive the file. And so my suggestion is that you can save all the receipts and invoices that you've incurred during this time. And when the blackout period ends, you just need to register with Green Shield, create an account, and submit everything to them online, and they will reimburse you.
Thank you, Farhat. I hope that answer helps you, Vanessa. For the next commonly asked question we have, can we use both healthcare plans when we go to the doctor's appointment? So I believe either of you, Natalie and Farhat, you can address this question.
So I'd be happy to take that question. So no, the two health insurance plans can't be used for the same expenses. The reason being because they don't cover the same expenses. So when you go to a doctor's office, you need to use your UHIP card. And this is because the University Health Insurance Plan is basic medical health insurance for international students. It's more or less an equivalent to the provincial health insurance plan that's offered to permanent residents and citizens that live here in Ontario. So that's called the Ontario Health Insurance Plan. If you remember from the presentation, you will have seen that when you heard the descriptions for the YFS and UXA plans, that OHIP is not, OHIP and UHIP are not acceptable insurances to opt out of the extended health insurance plan. That's the reason why, because they don't cover the same expenses. So UHIP covers visits to the doctors, visits to the hospital, laboratory testing, and it also covers repatriation in case the worst, and hopefully it never happens, situation of the passing of an insured member, then that covers repatriation back to the home country. But these are not expenditures that are covered by the extended health and dental insurance plans. So if you go to the dentist, you use your YFS or UXA plan. If you go to the doctors, you use your UHIP card. So you will find that for the most part, if you're generally well and you're having, like you want glasses or you want prescriptions or you want your teeth checked out, you're going to be using your YFS or UXA plans more. But if you're not feeling well, that's when you use your UHIP card. So that's a bit of a way to remember when to use which card. But for the most part, you can't use both of them at the same time.
Thank you so much, Natalie. We have another question in the chat. So regarding the travel insurance portion of UXA, does that mean I could drop my other travel insurance that I'm paying for from back home? For example, does Green Shield cover a trip back home? If that comes up for any reason, is it worldwide, and would it cover dependent travel as well? Farhat, can you answer this question?
Green Shield provides travel insurance for up to 60 days. So your place of residence will be considered Ontario because that is where the university is based. So any flights going out of Ontario will be covered. For example, if you want to go to your home country, so if you're flying out of Toronto to your home country, you can stay there for 60 days. If you fall sick or if anything happens to you, that will be covered. So yeah, any flights which are originating from your province of residence will be covered for 60 days.
Thank you so much, Farhat. I hope that answer helps you, Vanessa. Another commonly question that we also have is, how do I find a healthcare provider that accepts UHIP?
Okay, so this will be a topic discussed during your orientation, but there is a list of UHIP preferred providers. These are doctors' offices and hospitals and laboratories that have agreed to bill the insurance company directly. And the insurance company is Manulife. It's administered by Cowan, so you will hear me mention Cowan more than Manulife, but they work together to administer and offer the UHIP plan. So what you need to know right now is that Cowan has a website called the UHIP Preferred Providers Network, and that has a list of medical providers that will accept to bill the insurance company directly. You can still go to one that is not on the list, but what happens in those situations is that you will need to submit a claim to the insurance company to get your money back after your appointment. And I can give more information about that during the orientation, but just for now, just know there's a network and you need to be well aware of it. So I'll let you know more about that later.
Thank you. The next question that we usually have is what happens to my health insurance if I have deferred admission? I believe both Farhad and Natalie, you can answer this question depending on the insurance that the students have.
So for UHIP, if you're enrolled in classes and then you defer, what happens is that your UHIP coverage is terminated. So this happens automatically. So the registrar's office will send me a list of students that have deregistered or withdrawn, and therefore the insurance company will terminate coverage. Now, if you enroll again within this policy year, so in other words, if you register for classes in the summer, like say, for instance, if there's a delayed study permit or something like that, then you may not appear in the list of students that need to be enrolled in UHIP. So if this happens in your case, then you need to email the UHIP email address, so uhip@yorku.ca, in order to be manually enrolled into UHIP. So if you're in this situation, like you are intending to come in January, haven't received your study permit yet, but it gets to be January and you still haven't received it, and you do receive it afterwards, and therefore can come in May or can come in, well, actually, if you can come in May, then at that point in time, you would email me. If you can only come in September, then don't worry, you do not need to email me. I do not need to manually enroll you. You will show up on a list because it'll be a new policy year. So that's just to give you a sense of how your situation will be dealt with. But if you have any questions about deferrals, don't hesitate to send an email.
Thank you so much, Natalie. Farhad, is it the same situation apply to YUCSA health insurance?
Yes, it is the same situation. Usually when a student defers admission, we are informed by the Faculty of Graduate Studies, and we remove the student from the plan. And but if it depends on the timing when we get to know about it. For example, if you were supposed to start in January and you are not able to make it for any reason, and you plan to come in the summer now, so in that case we will not reverse the GSA charge because there is no summer enrollment for the YFS and the YUCSA plan. So if we remove you from the plan, you will be left without coverage for the 4 months of summer. So in that case, we will just leave the GSA charge in your account, and you will have benefits starting winter, even though you won't be using them until May. But it will still be covering you for the summer months.
Thank you so
But yeah,
much.
if you're deferring up to the next fall term, then definitely we'll reverse the charge and remove you from the plan.
Okay, thank you so much, Natalie and Farhad. And thank you for all your questions. And as a reminder, it's important to note the differences between the UHIP and the extended healthcare plan. There might be services that are covered by the UHIP but not covered by the extended healthcare plan. Therefore, this is a chance to ask if you have any questions. But for now, I would like to share some of the upcoming pre-arrival webinars and events. However, you can continue using the Q&A feature to ask any questions that you may have. We'll be coming back to the Q&A section again at the end of the webinar. And as a reminder, all the registration links to all the events will be shared in the chat. Okay. Global Peer Program, it's an amazing program brought to you by York International. In this program, you will get a chance to learn all about York from a student perspective and hear about experiences of current students at York. The program consists of 2 different events each month, which is the GPP community event and the GPP drop-in. The GPP monthly drop-in section is where you can get a chance to have a one-on-one conversation with a mentor who is a current international student at York, and it's a perfect opportunity to get all your questions and concerns addressed and gain insight about York from a student's perspective. The coming date for the November drop-in is November 21st. You are welcome to drop by any section anytime between 9 a.m. to 10 a.m. We're happy to have you here. Stepping into a new country and adapting to a different classroom culture can be both exciting and daunting. To help you feel more prepared and confident, our upcoming webinar, Preparing for a Canadian Classroom, on November 27th, will offer valuable insights and strategy for navigating the academic environment at York University. Similar to our GPP monthly drop-in, our monthly community event is a fun virtual event where you will also get a chance to connect to GPP mentors and meet your fellow international students. Our mentors will have discussions about different themes that will help you embark on your journey here to Canada with confidence. This month's theme is Traveling to Canada, and it will take place on Thursday, November 28th. We're looking forward to seeing you there. Coming to another country to pursue a higher education is admirable. However, it's understandable that the process can be confusing. But rest assured, in our coming webinar, Pathway to Success, Navigating Graduate School and Canadian Culture, taking place on December 11th, we'll offer you tips and tricks to navigate graduate school at York University and the Canadian culture as a whole. When I first arrived at the Canadian border, it was a little bit nerve-wracking and overwhelming, and some of y'all might share the same feelings. This webinar, Arriving at the Canadian Border on December 18th, is designed specifically to address these concerns by offering insights on how to navigate this experience as smoothly as possible. Here's our York International event calendar. You can find all the registration links for upcoming pre-arrival webinars, the GPP events, and other fun York International meetups. Calendar link is also be shared in the chat. Please take some time to follow us on social media so you can be extra updated with our future webinars and events. Before we end today's webinar, I will take a quick look to the chat to see if there are any last-minute questions. Okay, it seems like we're all set for the day. Thank you so much for joining us today. Thank you, Natalie and Farhat, for the information. We hope that some of your concerns are addressed and you will feel more confident with your journey in Canada. Looking forward to seeing you again at our future event.